Hard-hit Houston hospitals have been forced to treat hundreds of COVID-19 patients in their emergency rooms, sometimes for several hours or days, as they scramble to open additional intensive care beds. City officials have called for a 2-week stay-at-home order as coronavirus cases continue to overwhelm hospitals there. Joining us now, President and CEO of the Harris Health System in Houston, Dr. Esmaeil Porsa. Dr. Porsa, I guess, first of all, if you could describe the conditions, the situation, the numbers in your hospitals at this point right now.
Good morning. If I may, let me start by thanking all the nurses and doctors and the countless others who are on the front lines and truly are the heroes of this tragic story that is unfolding before us. And thank you for having me on your show. The situation, the best I can describe it, is dire and it's getting worse, seems like every day. As we are hopeful that we can turn for the better, it seems like every day we're setting a new record. Yesterday, we had the highest number of new cases in the greater Houston area, which is the 9 county regions, including the Harris County, where my hospitals are at. To answer your question specifically about my hospitals, there are 2 public hospitals in Houston, the LBJ Hospital and Ben Taub. LBJ Hospital has been over 100% capacity for ICU beds. As of yesterday, I think it was 113%. And that happens exactly to describe it. As we add more intensive care beds to the hospital, the capacity goes over 100%, meaning that every traditionally designated ICU bed at LBJ Hospital is already occupied. And 75% of those beds are now COVID-19 positive, which is really staggering.
Dr. Porsa, you're describing the situation as dire. Didn't this happen a few months ago? I feel like we are reliving the same story that we endured as a country a few months ago. Why is this happening again?
I really wish, actually, you were correct, that this is a reliving of what happened in April. I can tell you that in our region, what we believe to have been a peak, the number that I told you yesterday, about 400 new patients, that's 4 times the number of patients that we were admitting to the hospitals at the Texas Medical Center during the peak in April. So no, this is not really reliving what happened in April. This is a new beast. These numbers are disproportionately higher than anything we had experienced in the past.
Wow. Mike Barnacle, jump in.
So, Dr. Porsa, I understand that you've only assumed the position that you hold now since early in March. So, today, right now, what you're experiencing, what do you attribute this sudden spike, or is it a sudden spike? But it seems to be a sudden spike to outsiders viewing it. And secondly, what is your situation within your hospital with regard to PPE and the supply chain? Do your people, the nurses and doctors that you were just alluding to, thanking, do they have enough personal supplies, masks, things like that, needles, for testing and things like that, items like that?
Sure. So you had a couple of questions. To your first question about the sudden surge, it really is not so much of a sudden surge. It's just a very rapid surge. This was gradually growing since around in the beginning of May, and then it sped up in June. And at the time, it looked like, I was described as saying that the curve is really not a curve, it's like a straight line up. And that's what it looked like. And the reason is obvious, is the folks in our communities, in other communities across the United States, not heeding the words of the scientists, the clinicians about social distancing, about face covering, about staying home, especially when you're not feeling well. The reason is obvious now. Why that is happening? Is it because there is inconsistent messaging? If people just are tired, people just don't believe what they're seeing or hearing? I honestly don't know. I can tell you that it is extremely frustrating to be watching this unfold every day. and be telling people about the numbers in the hospital, the number of people who are sick, the number of people who have died or who are dying. And at the end of the day, this being a very preventable disease. And that is, I think, the frustrating part of this whole situation, that we people have the power to stop this disease in its tracks by doing the things that we know work. We know that because, not just because of the science, we know this because it worked previously. When there was a stay-home order here in Texas, we did very well. And we really thought that we were beginning to put an end to this disease. So that's the situation. And to your other question about the PPEs, we are very fortunate that because of the early actions in this area, as far as the stay-home orders and the social distancing and everything else, that bought us the time. At the time when we were talking about flattening the curve, I describe it as we want to flatten the curve to buy us, the healthcare folks, time to get our PPEs in order, get our hospitals in order, have our surge plans in order. And that's exactly what happened. So I'm happy to say that PPEs are not an issue at this time. I visit the hospitals routinely. I was there again yesterday. And my question to every one of my staff is, do you have what you need? And I'm happy to say that all of a sudden, yes. So PPE is not an issue. Needles, things of that nature are not an issue. What is an issue is the prolongation of this pandemic and the toll that it is taking on my staff and, frankly, all healthcare staff in this area, day in and day out, having to deal with increasing number of patients. It takes a physical toll and it takes a mental toll. And that is really important to discuss. And I think that is the story that is not being discussed openly.
Thank you so much for sharing it with us this morning. President and CEO of the Harris Health Group, Dr. Porsa, thank you very much for being on this morning. And joining us now, actually, we're going to go to break. Coming up, the disproportionate impact of the coronavirus shutdown on women, the gender gap when it comes to education and childcare, and being laid off. Plus, Joe Biden is focused on the swing states, but new data suggests he might want to think bigger. Why Democrats are now eyeing the map deep into red territory. We'll talk about that straight ahead when Morning Joe comes right back.
Thanks for checking out MSNBC on YouTube, and make sure you subscribe to stay up to date on the day's biggest stories. And you can click on any of the videos around us to watch more from Morning Joe and MSNBC. Thanks so much for watching.